Welcome to this edition of Shorts. I'm Dr. Vijay Shekhar, your pediatrician. Today, in this season of fevers, let me touch upon a topic of recent interest. Paracetamol is the commonest drug that we are using for fever, and of late we are seeing a lot of paracetamol poisoning, especially in children. It's happening in two ways. One, the syrup is tasty, and kids, especially toddlers, are just gobbling up a couple of bottles of paracetamol. Of course, the parents are coming to know of it immediately or in a couple of hours and rushing to the hospital, and we are able to do our bit and try to get them out of it. So what do we have to talk about it? Two things. Is it dangerous? Is paracetamol dangerous? While it's one of the safest medicines for fever, the fact is we are allowed to give up to 40 to 60 milligrams per kg of paracetamol to a patient. What happens when a child gobbles up an entire bottle is it crosses that limit. And if the limit crosses 150 mg per kg, then the problems start. Reactions can happen and poisoning can happen. Above 200 mg, it can even be fatal. 200 mg per kg. Now, the problem with paracetamol is it might not cause immediate reactions. It might not give you a hint that things are going wrong. But the liver can get damaged and it can cause total liver failure, even going up to a chance of liver transplantation. So it is dangerous. Does it happen commonly? No. It happens infrequently. About 1 in 100 patients who consume a dose of more than 200 mg per kg can go into this problem. Awareness is the key to avoid this problem. How do we avoid it? Number one, all paracetamols are not the same. If you take Crocin drops or Baby Jessic drops or Calpol drops or any brand of paracetamol drop, generally it is 100 mg per ml. So the dose has to depend on how many ml we give per kg. That is 0.1 ml. Now some kinds of brands also give 120 mg and 150 mg. So if you are making a substitution, be aware that the dose can change. What you have to give can change. If you have substituted drops for a syrup, things change because we have syrups which have 125 mg per 5 ml, 250 mg per 5 ml to 500 mg per 5 ml. So there are various dose ranges in each bottle. You have to be aware of what you are taking. So be very careful and make sure that your dose is calculated and approved by your pediatrician. A little here and there, no big deal, but more than that can be life-threatening. Thank you.